Hi, I'm Dr. Vinothkumar. I'm a prosthodontist in Rishik International University, Iraq. And this e-poster is a presentation of a case of a amyloblastoma in a 61-year-old male. After the resection, the reconstruction was done with a free flap fibula graft with microvascular anastomosis. We all know it's considered as the gold standard of rehabilitation, but when it comes to use of osseointegrated implants, there are some problems or drawbacks to this graft. The cross section of the graft is just about 1 centimeter, and usually it's in pyramidal shape and the narrow crest is placed superiorly, and this will not allow us in placing a longer implant more than 10 millimeters. And also because of the thin crest, we will have to use an implant which is just about 3.5 to 3.75 millimeter in diameter. And also it's essential to have a bicortical engagement because of the poor mineralization of the medullary bone. So in this case we used 3.75 into 10 mm, 3 implants of 3.75 into 10 mm from Alpha Bio. And also we used straight multi-units with polished collars about 7 millimeters in height, also from Alpha Bio. And this is mainly because the soft tissue thickness above the bone is a little bit too much, 1 to 2 centimeters in height, and mostly filled with fatty tissues which are prone for inflammatory reactions. And since we have a polished abutment neck, hopefully we will not have any inflammatory reaction and periimplantitis. And also when it comes to the restoration, we chose a screw retained porcelain fused to metal restoration, fixed restoration, instead of using an attachment and a removable restoration. There are some reasons why we chose this restoration. A removable restoration, for making an impression, like the soft tissue is too much compressible, and it's not possible to make an accurate impression. And also there is a lot of possibility that patient might develop a lot of food accumulation below the acrylic flanges, and the skin is not exposed to the oral environment, so eventually the skin has to get converted into oral mucosa after some time. So we call this process as naturalization. So in the presence of acrylic flanges, maybe this might take some time, and there are chances that the skin also might develop inflammatory reaction due to food accumulation below the flanges. So we try to keep the restoration smaller by choosing a fixed restoration, and we advise the patient to use water floss and other hygiene, oral hygiene maintenance aids. And as we hope to have a review also once in a while for about 3 to 6 months, and then we hope it stays for a long time. Thank you for listening to the presentation. That's the end of it.